our focus is on the COVID-19, and especially the, the article that I'm presenting is from Cleveland Clinic, where most of the COVID-19 infections and their hospitalizations are in unvaccinated people. So this is something that I want to focus today, and it is of a very serious concern. As you see over here, this what is supposed to be a steady decline almost to the zero is plateaued. In fact, maybe there's a little uptick that we are seeing in about 14 to 15,000 COVID infections in the United States, which is of a very serious concern. As you know from previous presentations, that there is a third of the Americans still not vaccinated. And that's of a serious concern, especially because of different variants from different countries, alpha, beta, gamma, delta. Delta, more specifically in India, where it has done tremendous damage, devastation. Literally, parking lots converted to open crematoriums, and it's sad. And these variants are supposed to spread very fast. And this is the graph that's showing that they're more transmissible, and at the same time, if they get infect the patient, there's a greater chance that there may be increased mortality or death. So this is a very serious concern. So what we need to do is to get back. Of course, we may have some ways to kind of say the variants of concern in this area and all those things, but still, most important thing is the vaccination. And unfortunately, we have, I'm sure that you heard about recently that there is a Methodist hospital in Houston, in Texas, that they were asking all their employees to be vaccinated in order to take care of the patients. And there is a group that has approached the courts, and they've actually gone to the federal court in Texas requesting an injunction to stop that order or a mandate from Methodist Hospital where any patient care activity will be done with only vaccinated people. So this is the outcome where basically the judge said that patients, essentially, I think, it's very, very important. The public interest is having a hospital care bill of caring for the patients during a pandemic far outweighs the protecting the vaccination preference of 116 employees. And the judge further wrote that, one second, the plaintiffs are not just jeopardizing their own health, they're jeopardizing the health of the doctors, the nurses, the support staff, the patients, and their families. So it's very clear from the courts, federal court in Texas ruling that it is a requirement for patients need to be cared for as vaccinated staff, because there is a concern that unvaccinated employees could potentially spread the deadly variant COVID-19. So this is very, very important. Now, the question that a lot of times people ask me is, what about the Pfizer and Moderna? Yes, they do have some effect on these variants, but it's not very clear and it's not very robust as would expect from the regular original virus. And as you know, that vaccine has been there for a while now, and we have pretty much eradicated smallpox, polio, and as you see that the measles is throughout the world, and especially underdeveloped countries. Measles is one of the main reasons of infant mortality, where the children die, and a lot of the malnutrition is from measles. It's very, very important. And the last point that I want to make is that last time I presented you a variety of, for those people who have been vaccinated, they're giving away a lot of goodies, and This is something that I saw was joints for jabs. In Washington State, evidently, they're turning to marijuana giveaways to encourage residents. So it looks like they're doing anything and everything possible to people get these people vaccinated. But the summer is coming, and I want you to know, if you want to go to Taj Mahal, which is, by the way, is open. It's reopened after COVID-19. And if you want to travel anywhere, they are requesting vaccination. So I want to emphasize the need for all of us to be vaccinated, and also talk to the people that are vaccinated and unvaccinated to make sure how important it is for us to be vaccinated. All right, go ahead.